Have you ever heard of ozone therapy? It's one of those treatments that pops up in wellness circles, often touted as a cure-all for everything from chronic fatigue to more serious illnesses. The idea behind it is pretty fascinating. It involves introducing ozone gas into your body to supposedly boost your oxygen levels, fight off infections, and reduce inflammation. But what's the real story here? Is it a revolutionary medical breakthrough, or just another wellness fad with more hype than substance? Today, we're diving deep into the world of ozone therapy to separate fact from fiction. So, what exactly is ozone? We all know about the ozone layer high up in the atmosphere, protecting us from the sun's harmful UV rays. That ozone is O3, a molecule made of 3 oxygen atoms. It's different from the stable O2 molecule we breathe every day. O3 is highly unstable and reactive. In medicine, ozone is created by passing medical-grade oxygen through an ozone generator. This produces a precise concentration of ozone mixed with oxygen. Proponents of ozone therapy claim it works wonders. They say that when introduced into the body, ozone can increase the amount of oxygen in your cells, a process called cellular oxygenation. The theory is that this supercharged oxygen environment can kill harmful bacteria and viruses, stimulate the immune system, and improve circulation. You might see it offered in various forms: autohemotherapy, where blood is drawn, mixed with ozone, and then re-injected rectal or vaginal insufflation, where the gas is introduced into the body, or even ozonated water or oils applied to the skin. The list of conditions that advocates say ozone therapy can treat is incredibly long. We're talking about things like autoimmune diseases, viral infections, circulatory disorders, chronic pain, and even some types of cancer. The claims are bold and often come with compelling personal testimonials from people who feel they've been cured. They talk about regaining energy, finding relief from years of pain, and achieving a new level of health. It's easy to see why someone struggling with a chronic condition would be drawn to these promises of a miracle cure. But here's where things get really complicated. When we turn to mainstream medical science, the picture looks very different. Major health organizations around the world, including the FDA in the United States, have not approved ozone therapy for the treatment of any disease. In fact, the FDA has gone as far as to say that ozone is a toxic gas with no known useful medical application in specific, adjunctive, or preventive therapy. That's a pretty strong statement. Why the skepticism? Well, a big part of it comes down to the lack of high-quality scientific evidence. While there are some small studies, often from outside major medical jurisdictions, they are frequently criticized for poor design, small sample sizes, and lack of control groups. In the world of medicine, the gold standard for proving a treatment works is the randomized controlled trial, where a new therapy is compared against a placebo or standard treatment. For ozone therapy, these large-scale, rigorous trials are largely missing. Without them, it is impossible for the medical community to confirm whether the reported benefits are real or simply due to the placebo effect. The placebo effect is a powerful phenomenon. When a person believes a treatment will work, they can sometimes experience real, measurable improvements in their symptoms, even if the treatment itself has no physiological effect. With a procedure as involved as ozone therapy, the expectation of feeling better can be very strong. Furthermore, there are significant safety concerns. Remember how I said ozone is a highly reactive gas? That reactivity is what makes it potentially dangerous. Inhaling ozone is known to be harmful to the lungs, causing irritation and damage to the respiratory tract. That's why you'll never see a legitimate clinic administering it through inhalation. But even with other methods, there are risks. Injecting ozonated blood, for example, carries the risk of air embolism, where a gas bubble enters a vein or artery and can block blood flow, potentially leading to a stroke or heart attack. There are also reports of infections from unsterile equipment and other serious side effects. The controversy is really a clash of two worlds. On one side, you have the world of alternative and complementary medicine, which often relies on anecdotal evidence, patient testimonials, and theories that may not align with our current understanding of biology. In this world, the personal experience of feeling better is paramount. Practitioners and patients might argue that mainstream medicine is too slow, too rigid, and too influenced by pharmaceutical companies to recognize the benefits of a simple, unpatentable substance like ozone. On the other side, you have the world of evidence-based medicine. This world operates on a strict hierarchy of evidence. Anecdotes and theories are just the starting point. To be accepted, a treatment must be rigorously tested through well-designed scientific studies that can be repeated and verified by other researchers. The primary guiding principle is first, do no harm. From this perspective, promoting a treatment without solid proof of its effectiveness and safety is considered irresponsible and potentially dangerous. So, where does this leave someone who is sick and looking for answers? It's a tough spot to be in. When you're dealing with a chronic illness that conventional medicine hasn't been able to solve, the allure of a promising alternative can be immense. It's completely understandable to want to explore every possible option. If you're considering it, do your homework. Ask the practitioner tough questions. What are their qualifications? What specific evidence can they provide for the condition you have? What are the potential risks and side effects? What is the total cost? Be wary of anyone who promises a cure, especially for serious diseases like cancer or AIDS. Be suspicious of clinics that rely solely on testimonials instead of scientific data. It's also vital to talk to your primary care doctor or a trusted medical professional before starting any new unproven treatment. They can help you understand the potential risks and whether it might interfere with any other treatments you're receiving. Abandoning proven effective therapies for an unproven one can have devastating consequences. Ultimately, the story of ozone therapy is a powerful reminder of the importance of scientific rigor in medicine. While it's essential to remain open-minded to new ideas, we also have a responsibility to ensure that the treatments we use are both safe and effective. The burden of proof lies with those who make the claims. Until proponents of ozone therapy can provide strong, consistent, and high-quality scientific evidence to back up their extraordinary claims, it will remain on the fringes of medicinal controversial therapy with doubtful efficacy and real potential risks. The journey to wellness can be long and complicated, and it's tempting to look for shortcuts or miracle cures. But true health is often built on a foundation of proven science, a healthy lifestyle, and a strong partnership with qualified healthcare professionals. Be an informed and empowered patient, ask questions, seek evidence, and make decisions that are truly in the best interest of your health. If you found this discussion helpful, please give this video a like and subscribe to the channel for more deep dives into health and wellness topics. Thanks for watching, and stay curious.